Hi there, everyone. My name is Dr. Michael Wald, and I want to thank you all for joining me today on what I consider an extremely important topic, and that would be everything about hormones. First, just a bit about me. My name is Dr. Michael Wald, and I practice in Westchester, New York, specifically in Chappaqua, which is located about an hour north of New York City. And I'm the host of Ask the Blood Detective, which is a weekly radio show that you can listen to. And now for the next 13 hours, you can actually watch as a Zoom PowerPoint presentation. You can find that on PRN FM, and you'll see that under Ask the Blood Detective, or you can go to my website under the blog section for all the radio shows that I've done, and that would be at drmichaelwald.com. You can email me with your show ideas, questions, or even criticisms about all the topics that I presented at info@blooddetective.com. So everything hormones is going to be exactly that, everything about hormones. So for the next hour or so, I would suggest that you buckle up your seats and prepare to listen. And also I would suggest you might want to take some notes. This is a complicated topic, even for health professionals, and different types of health professionals have different educations regarding hormones, and specifically around the natural treatment of hormone-related disorders. And we're going to review that, and there'll be a good deal of repetition because, after all, repetition is a method of learning. So we'll say some things over again in various ways. So once again, everything hormones is not a presentation for the light at heart, meaning that you will be receiving lots of details, the very same details that I presented in this actual talk to health professionals. But I don't want to insult your intelligence. This may be a learning experience for some of you, and for yet others, it might be just a reiteration of what you already know. But either way, I promise you, you'll be getting a lot of good stuff out of this presentation in terms of hormones. So let's proceed. To begin with, I want to give a disclaimer that the information contained in this talk today is for your education only. It's not meant to substitute for sound medical or health advice, so the use or misuse of this information is entirely up to you at your own risk. And again, more information about me here, because when you do search for a healthcare provider to help manage your hormones, you're going to want to know not only the cost of the health provider's fees, but also what their educational background is, so you can properly compare value. So just briefly, I have a Doctor of Chiropractic degree. I did attend medical school. I have a master's degree in human nutrition. I am double board certified in human nutrition. And in the state of New York, there is the Certified Nutrition Dietitian certification and the Certified Nutrition Specialist certification. I have both of those, along with the Sports Nutrition and PhD in Holistic Philosophy, and a few other educational certificates and diplomas. So let's talk about hormones, and let's talk about some general aspects of hormones. First of all, hormones are produced by hormone-secreting glands. So that might be the thyroid glands, which are located in your neck, or the parathyroid glands that, if my fist were your thyroid glands, the parathyroids would be located right on top. And there are our adrenal glands. Those are in our lower back. The kidneys are about the size of our fists, and then the adrenals about the size of your thumbs on top. So we have two adrenal glands, we have two thyroid glands, we have two parathyroid glands. We have an anterior pituitary gland in the brainstem and a posterior pituitary. There are the ovaries. Even the fat stores in the body produce hormones, like estrogen, for example. So common examples of some hormones I want to mention are DHEA. That's dihydroepiandrosterone. That's an adrenal hormone, which tends to increase throughout lifespan until you reach around the age of 30. Then it starts to tank. As hormones decline, such as DHEA, chronic disease increases, and health span reduces. Unless, of course, you optimize your hormone balance, but ultimately they will decline over time. Or the hormones might maintain certain levels, but your body's sensitivity to hormones through aging and various aging diseases will increase the propensity for hormones to have less and less effects upon your tissues. And that's part of the aging process. So there's the hormone decline theory of aging, which, as the name implies, suggests as your hormones decline with aging, and most of us age unnaturally, diseases increase. DHEA and cortisol and adrenaline are produced by the adrenal glands, estrogens by the ovaries and fat tissue, for example. testosterone by cells in the testicles of men, pregnenolone, progesterone, glucagon, growth hormone. All of these hormones are produced in both men and women, but to different amounts. And then hormones you should know fundamentally, as the last bullet here points out at the bottom, hormones are messengers between tissues, affecting repair, growth of tissues, and they relay messages between cells, tissues, and organs. So when we have problems with hormones, we're going to have problems with the communication, what's called the cross communication between tissues. So that communication gets, well, it gets messed up. And that abnormal communication will cause breakdown of tissues. And depending on how that breakdown appears in your particular body, that will give you your set of diseases and health issues, or optimal health issues. Now, hormones, as the saying goes, is you can't live with them, you can't live without them. Of course, you really can't live without them. People do live without optimal levels of hormones. And again, disease and other health problems can result. So first of all, as I mentioned, growth and repair of tissues is a fundamental role of many different hormones. So for example, if you don't have enough estrogen in the body or testosterone or growth hormone, you will lose lean body mass, you will lose muscle tissue, your skin and other organs will atrophy or shrink. And these are some of the non-specific effects of hormones. And depending how these non-specific effects affect your different organs, cells, and tissues, you'll have your set of concerns. Hormones do work in concert with one another. You know, I have patients that say to me often, Dr. Wald, you know, the fact that I have low thyroid hormones makes me want to work on my thyroid hormones. So how do we do that? And I remind my patients that thyroid hormones or any other hormones do not exist in a vacuum. When there is a change, either up or down of different hormones, there may be positive or negative feedbacks with yet other hormones. So quite often we have to consider a variety of hormones as contributing to our various health issues, and a focus on considering how hormones work together will go a long way towards optimizing your health. The nervous system, as bullet 3 here suggests, is a major target of hormones. So if you don't have enough, again, testosterone, growth hormone, estrogens, for example, you may have atrophy or shrinkage and lack of repair of nervous system structures. And your nervous system, which consists of your brain stem, your spinal cord, and all the peripheral nerves, will be affected adversely if you do not have various optimal levels of hormones. So all kinds of neurologic diseases can be helped by balancing hormones. And of course, thyroid hormone, as one example, is a key one in terms of metabolic rate. If you know anything about hormones, it's probably that low levels of thyroid hormones may result in gaining weight, not just weight in terms of fat, but weight in terms of fluid, which results in part by a decrease in the body's lean tissue. Lean tissue is everything other than fat and water. You lose the lean tissue, lifespan tends to be decreased, health span tends to be decreased, and of course that is indirectly or directly being caused by certain hormone imbalances. I should mention at this point that not all hormone imbalances are measured with hormone testing, whether it's saliva, urine, or blood testing. Hormones might be normal in all of those tissues, but you still could be suffering from the effects of low hormones, because even though you might have, let's say this is a normal level of a hormone, your tissues like the brain or your fat tissue or your muscle tissue or your heart tissue or your blood vessels, you name it, there are receptors in different tissues. And if your tissues are becoming insensitive to the thyroid hormones or any other hormones, the levels can be normal. They could even be high. But if the tissues are becoming insensitive, saying, well, I don't want to even acknowledge you're here, you might have a high level or a low level or a normal level, but still have deficiency states in terms of what you suffer from, or possibly excessive states, given how the body's tissues sensitivity is. Okay, so if your tissues are insensitive to hormones, that means the hormone levels can look high or low, but your body is just not reading them. And the reverse is also true. Not to worry, we're going to repeat that a bunch of times in different ways throughout this talk. But metabolism certainly is affected not just by a hypothyroid or a low thyroid state, but also by a low adrenal state. And the thyroid talks to the adrenal glands, and those tissues in turn have crosstalk with the anterior pituitary gland in the brainstem. So for example, if the brainstem detects that your thyroid hormones or adrenal hormones are low, it would create stimulating hormones, yet other hormones to try to stimulate the thyroid and the adrenal glands. And sometimes this happens throughout the course of years and even months, and then the body just can't produce anymore. That's when we run into trouble. And of course, hormones protect us against various diseases, given their various levels and how they crosstalk with different tissues. So we need hormones fundamentally to keep our tissues in the healthiest state. That's certainly an important way of thinking about it. And hormones, if they are out of balance, like melatonin levels being low or adrenal cortisol levels being high or even DHEA levels being high, these can affect sleep and our quality of sleep. And of course, if we don't have proper sleep, we will not have proper repair. So abnormal hormone levels, not just melatonin, can affect what's known as your sleep-wake cycles, the quality of your sleep, and the quality of your repair. Cardiovascular health, whether it's high cholesterol or other types of fats, or hardening of the arteries, or stroke or hypertension, all of these and other cardiovascular effects can result from imbalances of hormones. For example, high cortisol levels will contribute to high levels of the various hormones I've just mentioned, and perhaps the stress effect in the body, increasing cardiovascular risk. So hormone imbalance is almost always involved with cardiovascular disease. But if you go to a cardiologist, that physician will almost never even mention hormones. And if you visit a hormone doctor, which is an endocrinologist, they will almost never talk about atherosclerosis or stroke or these other things. So unfortunately, our medical so-called healthcare system, it's really a disease care system, is so compartmentalized that it sees the body in unnatural ways. And therefore, if it's seeing the body in unnatural ways, any treatment based on the philosophy of compartmentalization must be at the very least limited and oftentimes incorrect, certainly incomplete. And then tissue repair and inflammation reduction. Optimum hormone levels are needed for tissues to repair. If your tissues are not repairing correctly, they start to break down, and they are interpreted as foreign tissues in the body. And then the body will send antibodies out to tissues, and this is a vicious cycle of autoimmune disease. So autoimmune diseases tend to involve hormonal deficiencies or insufficiencies such that tissues do not repair. If they did repair, they would look more like normal tissues, and then your immune system wouldn't create antibodies to attack. So we need hormones, which, by the way, are also controlled by optimal diet, nutrition, stress, sleep, and environment and other factors. We will have a breakdown of tissues. The second to last bullet says that different hormones have various effects upon different tissues in the body. So what that means is that, for example, the thyroid hormones, they activate and they send messages to virtually all tissues, because all tissues in the body have receptors for thyroid hormone. So all that means is that receptors are sort of like seats where a thyroid hormone will sit in exactly, and it fits the thyroid hormone exactly. If this were estrogen right here, that might look like this. This is not going to fit in correctly. So receptors fit for each different type of hormone, and not all hormones have receptors in all tissues, but thyroid hormone does. So when you're in a hypothyroid condition or a low thyroid condition, you name the health problem, it could show up as any number of effects in the body. And physicians often miss putting together these signs. You'll see later when I talk about my hormone questionnaires that you can help identify through various symptoms what glands in the body and or tissues are affected by not just low thyroid hormone, but other hormones. Questionnaires and the education and the life experience of a healthcare provider are the best ways of determining what your hormone needs are. Testing of hormones, and this does vary, is generally inaccurate, but certainly needs to be considered in context with questionnaires and questioning of a patient to get it right. Let me say this again because I cannot reiterate it enough. Many of you out there think that it's a simple matter of just measuring hormones to know if they're high or low. Well, there's some truth to that, because if your hormone levels are extremely low, then those tests are accurate, and therefore you may need increased amounts of hormones. But depending on your health issues, your body may be trying to protect itself, let's say from cancers and other problems, by lowering hormone levels. So we wouldn't want to just increase hormones for the heck of it, because we need to consider the individual case of the person and whether or not that's the smartest thing to do. So for example, the lowering of estrogen levels naturally in women when they're menopausal does seem to be associated with a lower cancer risk, particularly of breast cancer and other estrogen-related cancers. So we wouldn't want to just simply jump in there and give synthetic estrogens to increase them. So that, again, is an individually based a clinical decision by your healthcare provider and, of course, your input as well. And then hormones work in concert either positively or negatively with other hormones. So what that means is that even though let's say your thyroid hormones might be completely normal, many people suffer from deficiency symptoms of thyroid hormone because other hormones that work with the thyroid and the tissue receptors are just weren't taken into consideration. So very important to never think of any hormones as working independently necessarily, because they almost never do. Let's talk a little bit about natural versus synthetic hormones. Let me put my face up here. So first of all, in terms of hormones, if they're made in your body, those are called endogenous, inside the body. And if they're made outside your body, they're called exogenous hormones. So growth hormone, for example, can be certainly is made in the body. And growth hormone may also be supplied as a synthetic variant that can be injected, usually subcutaneously in fat tissue. A common use of growth hormone in medicine would be for failure to thrive, kids that are not maintaining proper growth curves in terms of height. So growth hormone given before the growth plates fuse can help that individual grow. But there are potential side effects such as diabetes with the use of growth hormone injections. So growth hormone is also known as somatomedian C, and somatomedian is the best way to measure growth hormone in the blood. Growth hormone levels in the blood are not accurate. Growth hormone is produced by the anterior pituitary gland in the brainstem. So sometimes when we want to improve the body's ability to make growth hormone, we might actually use nervous system anterior pituitary tissue from a cow, let's say. So it's important to know that there are very, very important compounds in the nervous system that can help trigger the body to recover hormone balance besides just giving the hormone itself. Once again, that's not a clear-cut decision. That's based on the experience of the healthcare provider. And there are ways other than growth hormone or even giving growth hormone glandular, like anterior pituitary glandular, to increase growth hormone levels. For example, many people that are low in the amino acid arginine will have low growth hormone levels. Arginine is part of the growth hormone molecule, and high amounts of growth hormone can potentially increase growth hormone levels. And just taking more protein intake in the diet in general may also increase growth hormone production if the cause of low growth hormone is low arginine or low protein overall. Heavy exercise can also increase growth hormone levels. Aging tends to decrease hormone levels, as does infection and stress. And chronic infections or even acute infections have shown a much better response in terms of healing when a growth hormone levels are increased. And if growth hormone levels are low, that tends to be associated with immune deficiency and loss of lean body mass. And you need to know that loss of lean body mass is inversely related to all-cause morbidity and mortality. What the heck does that mean? That means that the lower your growth hormones, the higher the risk of you developing any number of chronic diseases, and the more narrow your health span becomes. Your health span, we want our health span to increase. Maybe our lifespan, we want them to increase, but almost all of us, it's fair to say, want our health spans increased. So increased physical activity enhances muscle and tissue growth by increasing growth hormone levels and possibly also testosterone levels. So let's talk about testosterone. Again, testosterone is in both men and women. It's higher in men than women. And as it tends to decline, any number of health problems can increase, such as increased fatness on the body and increased cholesterol and reduced ability to think, loss of memory, increased risk of infection, all sorts of things. So Testosterone can be given in an injection, can also be given in a topical cream, or we can use the diet, such as increased intake of certain healthy fats, which are primarily important for the body to use to increase testosterone levels. Sometimes we want to decrease testosterone levels because it might be stimulating estrogen production, because testosterone does make estrogen. And testosterone also makes dihydrotestosterone that tends to be high in men with male pattern baldness. Not to worry about me, folks. I shaved my head. That was voluntary. And natural substances like saw palmetto may reduce the production of dihydrotestosterone, which can offset male pattern baldness, and also baldness and hair loss in women, and also in men. Testosterone, when it's in excess or normal levels, but the body's hypersensitive to those normal levels, might also cause prostate enlargement and possibly, rarely it seems, prostate cancer. And also estrogen-related cancers, because as I've said, testosterone does form all three estrogens: estrone, estradiol, and estriol, E1, E2, and E3. So dihydrotestosterone, I've just mentioned, is a derivative of testosterone. And the thing about it is that it can cause not only prostate enlargement and male and female pattern baldness, but also acne. So we can block the production of DHT or dihydrotestosterone with certain medications like Avodart and certain herbs such as saw palmetto when the doses are correct. Let's talk about dihydrotestosterone, okay? This is DHEA. It looks like dihydroepiandrosterone, which is a derivative of testosterone, but this is dihydroepiandrosterone, or DHA, and DHA sulfate is the active form. This is adequately measured in blood, and that test is as accurate as a saliva DHEA. Not all hormones are as accurate checked in saliva as they are in blood. In fact, saliva, I feel, has been given too much credit for being more accurate than blood. They're both fairly inaccurate, but both are equally accurate for DHEA sulfate levels specifically, okay? So DHEA is produced by the adrenal glands. So as we grow older, our adrenal glands throughout our lifetime are stressed. So therefore the adrenal glands can shrink. Therefore there's less of the adrenal gland. They'll produce less DHEA. And as your DHEA start to decrease, as I mentioned earlier in the show, at about age 30 or so, the risk of all-cause morbidity and mortality will increase. So that's called an inverse relationship. And we have said that levels of DHA may decrease during aging. It's really during abnormal aging. Most of us age abnormally, and we know now that aging is a treatable disease according to Harvard. So stress, disease, pain, inflammation, along with unnatural aging and eventually natural aging will cause low levels of DHEA. If we increase DHEA in the right circumstances, we can help a person age much, much better. I've been supplementing myself with DHEA and other hormones for quite a long time. I'm 55 years old. I'm told I don't look 55. I certainly have the athleticism of a much younger person, lifting weights several times a week and doing karate for years and running marathons with no injuries. And then we have DHA in the form of oral supplementation, which I have a product right here, which is my form of DHA that you can find if you're interested on my website, which is blooddetective.com. The blooddetective.com website is for nutritional supplements. Okay, that's blooddetective.com. And my regular website is drmichaelwald.com. Alrighty, now when we go down a little further, we know that if DHA is in excessive amounts, it could cause excessive hair growth, but in all the wrong places. So PCOS is the medical term for polycystic ovarian disease, which almost always results in either high DHA and testosterone, which are the androgenic hormones, or normal levels of DHA and testosterone, but the body's tissues, including the hair follicles, are hypersensitive to the hormones and produce signs of too much. And that also tends to be associated with an increased propensity for diabetes. So we don't want DHEA too high or testosterone too high, depending on the individual who is prone to PCOS. or any forms of testosterone or estrogen-related cancers. So as my last bullet here shows, you do not want to be supplementing with testosterone or DHEA or estrogen if you have any history of cancers related to those hormones. So let's talk about some hormonal pathways here. So what does that mean? First of all, it means that cholesterol, okay, so cholesterol is up here at the top. Cholesterol is the main molecule that the body takes to build many other hormones. So cholesterol is here, which produces pregnenolone, which produces progesterone, which produces testosterone. Testosterone makes 3 different estrogens, okay? It makes estrone, estradiol, and estriol. And also testosterone makes DHEA. So cholesterol at the top is a really important molecule here. Cholesterol is a pre-hormone. So if we lower that, let's say with cholesterol-lowering medications, we are going to affect the production of everything from pregnenolone, progesterone, testosterone, and all the estrogens, which may be very detrimental. So that's very important to understand that. We do not want low cholesterol. In fact, low cholesterol is associated with increased risk of cancers, particularly when it's lower than 160 milligrams per deciliter. Most people have never heard of that, but not only will you find that in my textbook, which is a 500-page textbook written for doctors called the Anti-Aging Encyclopedia of Testing, but you'll find that in other laboratory textbooks as well. We don't want extremely low cholesterol. We won't make these hormones, and we need them. And we also need optimal health of the liver and small intestine, because the liver and small intestine, even the large intestine actually, help hormonal balance. So for example, if you don't have normal elimination through your intestinal tract, your body might resorb or suck back up hormones that it already used throughout the body and then put in the intestinal tract for excretion. But if the intestinal tract isn't eliminating properly, then a lot of these hormones can be recycled in the body and they can produce high levels of all sorts of hormonal imbalances. So when we're dealing with managing hormones, we have to deal with whatever the health issues are of the person. If they're constipated, if they have slow detoxification called phase 2 detox, that's going to cause high levels of certain types of estrogens, okay? So again, we need to think of other organs and tissues and glands other than the hormone secreting glands when we deal with hormone balancing. In fact, to not look at the entire individual as a whole, and that means practically, at least what I do, is I look and question my patients in each and every major area of the body, from digestion to neurologic to what seems to be just hormones to musculoskeletal to inflammatory, all sorts of other tissues, so you can look at the body as a whole and you can really get an overall picture of what does this person need. Because whatever your needs are nutritionally, whether it's through diet or even lifestyle or supplementation, you want to fix what your needs are, because that will help optimize your hormones, even though you may not be thinking of hormones directly. I'll tell you what I mean by that in just a few minutes. This page shows that there are pro-carcinogenic estrogens like 16-hydroxyestrogen. There are anti-cancer hormones like 2-hydroxyestrogen, and various nutrients like cruciferous vegetables, activated forms or methylated folic acid, the lignins or fibers found in flax seeds, along with the omega-3s in flax seeds and fish oil, along with indole-3 carbanols found in cruciferous vegetables, and also DIM or DIM. All of these and other nutrients help to balance the body's production of different hormones, promoting the production of anti-cancer estrogens. Now, soy products, this is important for you to hear this. There's a lot of controversy over soy products. Do they increase estrogen? Do they decrease estrogen? Are they safe for people with breast cancer or hormone-related cancers or not? Well, the answer is they are and they are not safe. This takes a lot of detailed work and consideration on the part of practitioners like myself to decide whether or not soy products are okay to consume. For example, we know, as my last bullet says here, that soy products may block different estrogen receptors, or they may block or bind to estrogens in circulation. So if soy binds to estrogen in circulation, this bound estrogen will not be used to stimulate a tissue, let's say like a breast tissue, to form breast cancer. But then again, if it's bound, it won't be used to, let's say, stimulate healthy skin production, because we all know that low levels of estrogen could cause unhealthy skin and wrinkles and atrophy of the skin. So on the other hand, depending on the person you're giving soy products to, which have estrogen-like hormones in them, quote unquote, that soy product may stimulate the breast cancer as if it were estrogen, even though it's not. It looks similar. So let's say estrogen looks like this. The soy product might look like that. It looks really similar, but it's not the same. So it can sort of stimulate the receptor and cause hyperestrogen symptoms, or it can kind of block other estrogens from coming in here, you see, by taking that place. So estrogens might work as estrogens. I should say soy products may work as estrogens, or soy products may block estrogens, or a combination of both those effects. So until you see a qualified healthcare provider who understands these pathways and what I'm discussing with you, you probably should not consume any soy products at all. And the same is true for wild yams. Let's jump to melatonin. So melatonin is a hormone that's produced by the pituitary gland in the brain. The pituitary is sometimes associated with the third eye. So it's important, obviously, for sleep-wake cycle at a dose anywhere between 1 and 12 milligrams. For some of you are saying 12 milligrams, that sounds like a lot. Well, a lot is always relative. Plus 12 milligrams is sort of a magic number based on my cancer research that shows that melatonin may be very anti-cancerous at the higher end of the dose scale. But even doses as low as 3 milligrams seem to be positively affecting those with COVID, reducing the extent of that disease, improving recovery, reducing the inflammatory cascades that are stimulated by COVID-19. So very important to consider melatonin for that. And as I mentioned, the second bullet here says that melatonin has anti-cancer effects in breast cancer, and it should only be taken at night. If you take melatonin during the day, then you will cause abnormal feedback mechanisms, which could actually increase your risk of cancers like breast cancer, probably even prostate cancer. So I do have melatonin. I have pharmaceutical grade products, which you can find on blooddetective.com. If you go to my regular website, which is drmichaelwald.com, at the top of the page, the drop-down menus, you will also see Blood Detective supplement link to the Blood Detective site if you want to use my products. And if you're a day-night worker where your sleep cycle is reversed, and if that's an ongoing thing with you, then melatonin would be safer to take during the day. But again, remember my disclaimer. Also, low melatonin is associated with increased risk of all sorts of diseases, because if we're not resting properly, our immune system is affected, how we control inflammation is affected. Need I say more? We're going to have all kinds of problems with melatonin, or from melatonin deficiency, I should say. And low levels of melatonin, or normal levels, but the body's less receptive to melatonin, which amounts to being low, right, can cause or aggravate depression, anxiety, immune system. It can affect adversely conditions such as irritable bowel syndrome. In fact, with irritable bowel syndrome, people who take more melatonin have far less pain and discomfort, probably because melatonin increases serotonin in the body, which we need for sleep. But serotonin is a neurotransmitter that's not only in the brain needed for sleep and positive mood and management of anxiety, but it's also more numerative. There's more melatonin in the intestinal tract than there is the brain. That's why we now have a whole new area of medicine where we're calling the digestive tract the second brain. And my last bullet here is that melatonin, though, if you take it and you're already on SSRI drugs, that's serotonin inhibitor drugs, which are drugs which keep serotonin around longer, and you take melatonin, you're going to produce more serotonin. And if you're also taking another inhibitory neurotransmitter called GABA, G-A-B-A, it's down here at the last bullet here, you might increase your serotonin too much and create a very dangerous scenario called hyperserotonin syndrome. So look, with every nutritional supplement, it has positive and negative feedbacks. There are reverse effects of many of these hormones where melatonin at one level can have many positive health benefits, at another level can be actually quite detrimental. And there's an entire 1,000-page book on the reverse effect, where higher levels of nutrients may have exact opposite than lower levels of the same nutrient or hormone in this case. Let's talk about thyroid hormone. I'm going to speak about thyroid hormone in some detail because this is a hormone that most people know and care about, mostly because of its connection to weight. So basically, thyroid hormones include T3 and free T3, free T4, total T3, total T4, and also TSH. Now, TSH is thyroid stimulating hormone. It's not really a thyroid hormone. TSH is made by the anterior pituitary in the brainstem. So if your body has low levels of thyroid hormones, your anterior pituitary will sense this in the blood and make thyroid stimulating hormone, which is a chemical that stimulates the thyroid glands here in your neck to make more thyroid hormones. Now, if your thyroid gland can respond to the TSH, it will make more, but it doesn't always respond. That's why you might say a high level of TSH, which should be associated with a higher level of thyroid hormone, but you might be low. So that just means your whole compensatory hormone feedback mechanism is not working properly anymore. And in terms of testing, most doctors do not seem to understand that a proper thyroid hormone testing must always involve TSH, and I would suggest total T4 and free T3, and 2 antibodies. Thyroid peroxidase antibody, two thyroid antibodies, thyroid peroxidase antibody and thyroglobulin antibodies. I'll repeat that. Thyroid peroxidase antibodies and thyroglobulin antibodies. These 2 antibodies can bind or block thyroid hormone production and or the thyroid tissue. So thyroglobulin is a normal constituent of your thyroid gland. But if your body's making thyroglobulin antibodies, that means your immune system thinks your thyroid glands are foreign and is making thyroglobulin antibodies anti the body against them. And that will cause you not to produce enough thyroid hormone. Now, your blood test might still show you have a normal level, but you might have all the symptoms of low levels because the antibodies are blocking the thyroid hormone. It's particularly true with the production of thyroid hormones when we're dealing with thyroid peroxidase antibodies. So thyroid peroxidase is an enzyme that converts T4 thyroid hormone to T3. So T4 to T3. The enzyme is in the middle. So T4 becomes T3 because it's acted upon by an enzyme here called thyroid peroxidase antibody. Now, if you have an antibody against the enzyme here called thyroid peroxidase, which allows T4 to become T3, but there's an antibody against it, you're not going to produce T3 from T4, or you'll produce much less. So it's important to measure those antibodies. Most doctors do not do that. I don't know why. It's just really poor training, I would have to say. Now, in order to have T4 make T3, right, it's T4 is one more than T3, the body has to take an iodine off. So one iodine taken off T4 gives you T3. And free T3 active thyroid hormone is far, far more, at least 100 times or so more effective, even more than that, than T4 thyroid hormone. So sometimes a person will need T4 synthetic hormones or T3 synthetic hormones or a combination of both of those synthetically, or a gland like armor thyroid, which contains a combination of all these different hormones and many, many other nutritional factors that's in a gland of a cow or a pig, which is also found in the body. But remember, just because armor thyroid might be natural because it comes from an animal, it's not natural to your body, so it's not exactly a perfect situation. I always prefer to try to improve upon lifestyle with a combination of sleep and reduction of stress and correcting whatever abnormalities I find with the person on top of improving overall hormone issues without giving hormones whenever possible. I want to first have the body stimulate its own production of hormones, because if you take hormones, whether they're natural or synthetic, you will be causing your body to make less of that hormone over time. And sometimes your body will never come back even after you discontinue the synthetic or natural hormones. So that's not my first way of approaching hormone imbalances by just giving the hormone. And when we want to use nutrition to make more, let's say T3 hormone or free T3, we have to include selenium, a certain amount of biotin, which is in the B vitamin family, zinc, vitamin D, vitamin B2. These and other nutrients are needed to convert T4 to T3. And again, you need the right nutrients for the right person at the right doses at the right time. So I figure that out through careful conversation with my patients, looking at comprehensive laboratory work, comparing their hormones to people, males or females their age, but also to males and females that are much younger, which have less disease. And we might want to reduce the fluoride in the person's intake in terms of, let's say, toothpaste, because I have had patients where fluoride has caused hypothyroid and had a complete cure of hypothyroidism in a young boy. I think he was around 13. He visited at least 2 doctors, I think a primary healthcare provider who referred him to the endocrinologist. The endocrinologist said, you have to take hormones. The dad said, I don't want to do that. And we did a couple of simple adjustments, including eliminating fluoride toothpaste. And this boy had his thyroid hormone reversed and his hypothyroidism was cured. I say it here on this video because if I have to prove it, I can. So, you know, there's a lot of claims going on these days. So whatever else I'm telling you here, you can bet it's the truth and it's scientific. And other times we want to also include other hormone levels when we look at the thyroid hormones, but we have to recognize that you have to lose approximately 30 to 40% of your thyroid function before a blood test will even show anything. So you could be suffering from hypothyroid symptoms ranging from depression, anxiety, to dry skin, to muscle atrophy, to overweight, to brain fog, to high cholesterol, you name it. And your thyroid hormones, including the TSH, are normal. And most of the regular physicians, they scratch their heads about this because they're not understanding the connections with these hormones. And if you do have hypo or low thyroid hormone, you might make that worse by eating cruciferous vegetables, which include broccoli and cauliflower. And those foods are supposed to be healthy, right? But when we say a food is supposed to be healthy or foods, we need to qualify that and say healthy for what? We know those goitrogenic foods block thyroid hormone. So we wouldn't want those in a patient who is desiring to have their thyroid hormones increased. So let's talk about hypo and hyperthyroidism. So first, hypo is low and hyper is high. As I said here, hypo is deficient, hyper is high. And as I mentioned, we have to lose about 40% of our thyroid function before blood testing shows anything. And then there could be thyroid antibodies. Now, oftentimes patients will say to me, Dr. Wald, I visited my endocrinologist. He says or she says my thyroid hormones are normal, but I'm having all of these hypothyroid symptoms. And then I measure their antibodies, and their antibody levels, either one or the other, are high or both. If antibody levels are high, here's what you have. You have thyroid hormones, which is this pen, and then you have antibodies. Now we want this pen free because we want a free T3 or free T4 to stimulate various tissues so you're not hypo. But if this antibody is bound to this, or the antibody is blocked at the tissue site where it can't get in, then you're going to suffer from hypo signs, even though the amount of the thyroid hormone might look normal on the test. Okay, I told you to take notes. But this is also, some of this information is found in my nutritional endocrinology presentation that you can find at prnfm.com, or you can go to the blog area of my website or the homepage search bar at drmichaelwald.com or intmedny.com. So we don't ever want to consider just thyroid hormones alone when we're dealing with the body, because if they are low or they are high, they do have feedback with other hormones and other tissues affecting things that are not hormones, like cholesterol levels or blood sugar levels or inflammation levels or immune system or your nervous system. So you see how thyroid symptoms can show up as any number of symptoms that might, or which may or may not be obvious on blood testing. I also did an interview with Channel 11 Pics, which you'll find on my homepage at the bottom of the screen. And I was asked how you best figure out if someone has a need for testosterone. And I mentioned, just like an endocrinologist who was interviewed just after me about estrogen, and he said the same thing, is that blood testing is just not that accurate. it's a clinical decision-making process, and we deal with it with, within that context and a good deal of questionnaires which help us figure it out. So hypothyroid symptoms, low thyroid symptoms, I'll just mention, include being swollen, fluid retention, and obese, or just over fat. Okay, that's just what's blocked behind my picture here. And then also back pain, particularly in the low back, because hypothyroidism is associated with too much of a lumbar curve. So like if you have a sway back, and also thyroid hormone conversion from T4 to T3 happens in the musculoskeletal system. So all sorts of musculoskeletal symptom problems can result from having low thyroid hormones, or normal thyroid hormones are high that are being interfered with, that end up giving symptoms of hypo or low thyroid. Dry skin, thin skin, depression, anxiety, low energy, brain fog, aches and pains. These are just some of the symptoms. Any of you could email me as well and request my hormone questionnaire. It's free of charge, just so you can kind of assess yourself. It points your thinking into looking at things in a very detailed way that most of your doctors will not question you to this extent, but you can figure it out yourself, at least partly. So no thyroid conversation would be of use unless I at least briefly mention some of the more common nutrients involved in hypothyroidism. Not all hypothyroidism is a result of nutritional problems, but often it is. So herbs like ashwagandha. Ashwagandha is very, very important for increasing the conversion of T4 to T3. Zinc citrate also helps in that regard. And tyrosine is the T, tyrosine T for T4 and T3. So T4 has 4 tyrosine molecules, and T3, let me restate that. T4 has tyrosine and 4 iodine molecules attached to it. T3 has 3 iodine molecules attached to it. So if you're deficient in tyrosine, or you're deficient and/or in the iodines, you can get hypothyroidism. We also need iodine, obviously. We don't want too much either. I've seen many patients incorrectly supplement themselves with iodine based on urinary iodine spilling tests, causing thyroiditis and some severe thyroid problems. So we always want the right dose. Copper is needed for thyroid hormone production, as is molybdenum. The B vitamins, as I mentioned, cayenne pepper, and bladderwrack. Now let's talk about adrenal hormones. The adrenal glands are those glands I mentioned that are on top of the kidneys in the body. We have 2 of them. And over time, just like a lot of our tissue secreting glands, the adrenal glands get weak. And as I mentioned, the DHEA levels tend to go down. During stress, cortisol levels tend to go up. Most of you are familiar with elevated cortisol levels and fat around the waist. But many people, I would even say most, in my 32 or 3 year experience dealing with hormones, is that a person may have all the symptoms of high cortisol, but the saliva tests show that they're normal or they're deficient. That means they were once high, but at the particular time you're testing them, there's something else. So I almost never measure cortisol, because if I expect the person's adrenals to be a bit burnt out, I'm not relying on the test for that, because they're just not that accurate. They're a waste of money in almost every case. So we also know, as I mentioned, that as aging goes forward, we tend to have a reduction in DHEA and in cortisol levels, which creates an inflammatory atmosphere in the body and negative feedback with other hormones, and we have more disease. If you, for example, as my 3rd bullet says here, if you malabsorb, let's say, certain healthy fats in the body, you will have lower adrenal hormones. Now, I should mention too, in natural medicine, we talk about adrenals, the adrenals being blown out, or adrenal weakness, or adrenal hormone deficiency, but that usually means that DHA levels may be a little low, or cortisol may be a little low, or the hormone levels may be just fine, but the doctor sees the symptoms in a person of weak adrenals. If you use the term weak adrenals with a physician, a medical doctor, endocrinologist, or internist, they think you're talking about a clinical condition of low hormones, which is called Addison's disease. You may not have Addison's disease, that's fairly rare, but you might have some percentage of low levels, which isn't quite to that extreme. So there's hyperadrenalism, there's hypoadrenalism, and then there's gradations in between. This is where the doctors get lost because they actually think somehow there's only low and there's only high, which of course is ridiculous. More people tend to be in these stages. And by the time you are in these stages, by the time you get high or by the time you get low, you've been there usually many months to many years. So things like adequate sleep, optimizing nutrition, optimizing exercise and other factors, reducing one's exposure to various electromagnetic and other forms of radiation can go a long way towards balancing and optimizing your adrenal hormones. The adrenal hormones have to do with the stress response. The stress response in the body will set the stage of how you age. If your body's in a chronic stress response, the adrenals are overworking too much, you're going to get more disease. That's what happens, along with, things like anxiety. Let's talk about hormones in plants. Now, there are really no hormones in plants. I should say there are plant hormones in plants that plants use, but in wild yam and soy, for example, which are plants, there are hormone-like chemicals that, again, let's say this bottle represents estrogen. Plants have something that looks like estrogen like this, but it's not estrogen. And to convert this to estrogen or testosterone or progesterone in the body, this has to be taken out of the body and then worked on in a laboratory to remove this molecule to make this stuff, which is the actual hormone. So because this process occurs out of the body, these so-called natural hormones are not natural. They are plant hormones. And if we're talking about tissue glandulars from cows and pigs, they have natural hormones if you're a cow or a pig, but not if you're a human. So the body is very smart, so it knows when we're trying to fool it in these ways. And usually we have detrimental effects. But nutrition and lifestyle can offset those effects because sometimes we need to use exogenous hormones or what I call pre-hormones that are acted upon in the laboratory. So that basically summarizes this particular chart, except the last two bullets, that when it comes to children, we have to be especially careful with the hormones that we give them because we do not want to stimulate growth of cells which could cause cancers like leukemia in children. And a little bit more on the whole concept of synthetic hormones. So hormone replacement therapy, or HRT, versus what I call hormone substitution therapy. So when a person is taking hormone replacement, their doctors will give them synthetic hormones, and they say to the patient, well, these are replacing your hormones, but they're not, because they're not natural. So they're really substituting, you see, and it's important that you know the difference. So no matter the way in which you want to balance your hormones, it's important to consider nutrition very carefully because they can offset, the proper nutrition can offset negative effects of various synthetic hormones and even natural hormones. Birth control pills, we know, have the tendency to increase cancer of the breast and ovaries. Many of you out there, if you were ever diagnosed with breast cancer, for example, the first thing your doctor does when they find out that you're on birth control pills is they immediately take you off. But for years, they denied that these things would actually promote cancer. Estrogen is a cancer-causing agent. If you live long enough and you're taking estrogen or you make too much, you will get cancer. Bioidentical hormones could be synthetic, but they are biologically identical to yours. And then the bottom line, synthetic hormones act more often than not adversely in the body, being several hundred or several thousand times higher in their hormone stimulating effects, like estrogenic compounds from plastics manufacturing that are spilled out in the environment act as super estrogens, you see, as do birth control pills and hormone substitution therapy. And some of the deficiency symptoms or inadequacy symptoms of hormones include weight gain, as I've said, either obesity or just being over fat, thin person, meaning you have too much fat relative to lean mass on your body, brittle hair, nails, vaginal dryness, wrinkles, forgetfulness, bone loss, inflammation, autoimmune disease, anxiety, sleep disturbances. So many different hormones can cause these problems. And oftentimes it's a combination of a variety of hormones that the levels may be deficient or they may look normal, but your body, again, is insensitive to them. So your body increases them to try to say to your body, well, please notice me, but your body may build up more of a resistance. So the levels are very confusing oftentimes. But benefits of hormones, when you get it right, increase your muscle mass, can help shape your body better, increase your strength and tone, increase your organ mass. So the heart atrophies, the brain atrophies, the adrenals atrophy. So when you have the proper balance of hormones, you can offset that effect. Also, when you fix hormones of various types, you could potentially increase memory, reduce overall sense of well-being. That's a common thing that people who get their hormones balanced right after months or years of having them low tend to say. There's improved immunity. There's increased time a person tends to spend in the non-disability stage of life, which is a fancy term for saying the longer you live without as many symptoms, health concerns like chronic diseases. And our last bullet says, and it's a very important one, that the overall effects of hormones are specific to that hormone. So there are certain hormones like testosterone tends to give more or less these symptoms. Adrenal hormone deficiencies more or less tend to give these symptoms. Progesterone, testosterone, estrogen, DHEA, pregnenolone. I think you get the point. But then there's some other combination of symptoms that might result from any combination of different hormonal imbalances taken together. I hope that makes sense. And then some other symptoms of hormone imbalances include accelerated aging, reduced fitness, and environmentally speaking, these xenoestrogens like the plastics in the environment, toxins such as heavy metals. For example, cadmium, which is a heavy metal, is acts as a superestrogen in the body, so it's very important. And whenever I get patients tested for hormones, I will always check mercury. I will always check arsenic, which is not strictly a metal, but it is a toxin, cadmium and lead, for example, because these hormones are also known as, these metals as hormone disruptors. Any number of diseases can result from hormone levels that are too high, hormone levels that are too low, or hormone levels that are normal, but relative to the person's needs should be higher than normal or lower than normal. Okay. And then we have here normal levels of hormones versus optimal levels of hormones. So when you have hormone levels checked, you have to realize that, let's say, for example, you're 50 years old, your hormone levels are going to be checked against men or women that are in that age group. And normally those hormone levels tend to go down. And I have to correct myself. It's not normally, but we commonly see, along with aging, hormone levels drop with age, but we also see increased risk of all cause of disease and loss of that non-disability stage of life. So maybe you need your newest normal, some other level placed within the normal range, or maybe you need more than normal, or maybe you need less than normal, depending on your health conditions. But those you'll never figure out by going to traditional doctors who merely look at lab tests by saying, well, you're in the range, so I don't know why you're experiencing all those symptoms, because you're not in the optimal range. And then you should be aware that there are blood levels, saliva, urine levels, and then there are indirect tests, which will tell us about whether or not your hormone levels are from these other concerns. So for example, if you malabsorb or you have stress and other health problems, this is where you need to fix these areas, because if you malabsorb proteins and you don't absorb your protein to get your arginine to make your growth hormone, or you malabsorb fats, you won't make the proper anti-cancer estrogens or progesterone, you see. So these are non-hormone tests which help you with hormones. And again, eating a non-processed diet, eating a large amount of fruits and vegetables, minus the cruciferous ones if you have hypothyroidism, proper water intake, avoiding dehydration, considering various medications, your intake of omega-3 fatty acids, exercise, managing your sleep and stress, and again, strength training exercises to increase hormones are all very fundamental for hormone correction. And other hormones that, and nutrients that might help your body make more optimal levels, I should say, of hormones include adrenal glandulars or anti-pituitary glandulars or thyroid glandulars, or actually taking DHEA certain proteins like arginine for growth hormone, ginseng, licorice, these for adrenal stimulation. Okay, it's impossible for me to teach you all of the connections, but I wanted to give you at least some. So when it comes to hormone testing, generally speaking, hormone tests of various types are generally inaccurate and misleading, except in the cases of severe deficiency. If you're deficient, then you're clearly deficient. And then, as my last bullet here says, hormone levels can be high or low, and you might suffer from various symptoms of deficiency or excesses given the receptivity of your tissues relative to the presence of antibodies or problems with receptors. So our last slide here reviews the fact that you want to look at all the organ systems. I do this, the blood detective approach is by using questionnaires to assess the whole body, looking at your body composition to know what your intake of protein, sugar, and fats, proteins, starches, and healthy fats should be, because these foods affect hormones. Various vitamin and mineral use tests, not merely levels of hormones or levels of nutrients. I look at all the body systems within my lifestyle questionnaire. I look at food questionnaires and specific tests for your needs. This is how I figure it out. So in summary, I do hope that you got some valuable information from this hormone presentation. Let me know your thoughts. Go to my website at intmedny.com, or you can go to drmichaelwald.com. Email me if you'd like to become a patient or you'd like my hormone questionnaire sent to you free of charge by emailing me at info@blooddetective.com. Please only call me if you want to schedule yourself as a patient. And I'm offering a free 15-minute consultation over the phone to discuss your needs to see if I'm the right practitioner for you. So once again, I'm Dr. Michael Wald, the Blood Detective. I'll see you next show. Thanks, everyone.